Welcome to our webinar, Need Help Billing and Therapy Notes? We can help. We are an approved TherapyNotes billing partner. Do you have to use TherapyNotes to use our mental health billing service? It's important to stress that you do not have to use TherapyNotes or any EMR in order to use our service. We have easy online forms providers can complete to provide patient demographics or billing, and we can obtain patient information and billing from certain other EMRs. Other EMRs you might have to export patient demographics and billing to provide to us. Now, not all practices require the same level of service. Providers should only pay for those services that they need. Therefore, for TherapyNotes users, we offer two different levels of service, Platinum and Premium Plus. For the Platinum service, we can handle all billing responsibilities, setting up new patients, verifying insurance benefits, submitting claims, posting payments, following up on denied claims, providing a revenue report upon request. For setting up new patients, the biggest problem with rejected claims is not setting up the patients correctly. For example, maybe you entered the wrong insurance payer or the wrong ID number, so we provide you three options if using our service. You can set up all new patients yourself, or we strongly recommend that you utilize the patient portal and TherapyNotes. On a daily basis, we can download the client insurance form and accurately enter insurance information into TherapyNotes. Or you can complete a simple, secure online form on our website. We then will accurately set up the patient in TherapyNotes. If you choose this third option, you can still set up the patient with basic demographics so you can schedule the patient. It is highly recommended that you upload a scanned copy, front and back, of the patient's insurance card into TherapyNotes. For any new patients or for patients who change insurance, if you are enrolled for our Platinum service, we will verify eligibility and benefits. We will enter the information on the Billing Settings tab for the patient. We'll provide the effective date, deductible, copay, coinsurance, out-of-pocket max information. We'll indicate if claims go to a third-party payer. If authorization or a referral is required, we will indicate that. If you need to know if a specific CPT code is covered, such as 90847 or psych testing codes, let us know in advance. Benefit information is generally entered in TherapyNotes by the next business day. There is a limit of 3 requests per day and 60 per billing month. You can request more than that. However, there is a fee of $11.95 per each additional verification above 60 during a billing month. For existing patients with the same insurance since the last visit, we offer an optional verification service for $11.95 per verification. This service is designed primarily to see if a patient's benefits have changed for a new benefit year, or if a patient has met his or her deductible or out-of-pocket max for the year. On a daily basis, we will log into your TherapyNotes account and submit your claims ready to submit electronic and paper. We will review any claims that may have rejected electronically. If we're able to determine the reason for the rejection, we will correct and resubmit. If we cannot determine the reason, we will follow up with the payer. And if we require your assistance, we will securely notify you of this so you can provide us corrected information. For EAP billing, we are able to submit to those payers that allow electronic submission, such as United, Optum, and Cigna. For payers like Magellan and Carillon that require EAP claims to be submitted via their specific online forms, providers will submit these forms themselves because of the requirement for clinical information. If you are doing EAP work for United and Cigna, we do recommend that we set up separate EAP payers because of the payer-specific requirements for EAP billing. For secondary claim submission, if a patient has secondary insurance that is not automatically crossed over by the primary payer, we will submit claims electronically in TherapyNotes if the secondary payer allows secondary electronic submissions. If they do not allow secondary electronic submissions, we will print the secondary claim and mail to the payer with the primary payer EOB. It is important to note that in TherapyNotes we can only submit secondary claims electronically if the primary insurance payment is via an ERA file. If the payment was not posted via an ERA file but posted manually, then we do have to submit the secondary claim on paper. Every day we will go and post your payments in TherapyNotes. We will ensure your office is enrolled with all possible payers to receive the electronic EOBs. Again, for claims that may have denied in error or where we cannot determine why the claim denied, we will automatically follow up with the payer. For claims that denied because coverage terminated or eligibility was not found, we will notify you of this. For any EOBs you receive in the mail, you will scan those EOBs you receive that are not also found under ERA and TherapyNotes, securely upload them to our website. We will manually post those EOBs in TherapyNotes. For any payers that offer ERAs through another platform but are not available for TherapyNotes to receive, we will download those EOBs from the other platform, upload them into TherapyNotes, and then post the ERA file. Assuming your office is enrolled for our Platinum service, follow-up of outstanding or denied primary insurance claims that we have submitted is included in this level of service. Again, when we post EOBs from payers, if a claim rejects an error or we cannot determine from the EOB why the claim rejected, we will automatically follow up with the payer. For any primary insurance claims that remain outstanding more than 30 days after we have submitted the claim, we will automatically follow up with the payer. If after speaking with the payer, we require additional information from you, we will securely notify you of this. In order for us to follow up on any outstanding claims or open claims, you do have a requirement at least once a week and preferably every day. Your office must provide us copies of EOBs you receive that are not found in TherapyNotes under ERAs. Do you pay your clinicians a percentage of the amount paid by insurance? If so, you are probably using the revenue report in TherapyNotes. You can run that report easily yourself, or upon request, we can provide you the report upon your schedule. But are you aware the revenue report is based upon the date of the payment and that this can cause problems? For example, if on Saturday the 15th, we run a report for the week that ends on Friday the 14th, and then on Monday the 17th, we post a payment from a payer with a payment date of Friday the 14th, that payment is lost for revenue report purposes. If we know you will be wanting us to run the revenue report, the way we get around this is by changing the payment date. In the above example, for the payment received on Monday the 17th, to ensure that payment is reflected on the next revenue report, we would change the payment date when posting in TherapyNotes from Friday the 14th to Monday the 17th. For the Premium Plus service, we set up all new patients in TherapyNotes. On a daily basis, we again review and submit all claims. We submit all secondary claims, review and post all EOBs, and provide the revenue report upon request. Verification of benefits is optional, and follow-up is on demand. That's an optional service. We will notify you, though, of all claims that deny an error and require follow-up. For the Platinum service, the standard rate is $3.99 per claim with a minimum fee of $199.95 per month. A 1,000 claim annual prepayment option is $3.65 per claim. A 2,000 claim annual prepayment option is $3.35 per claim. With the annual prepayment option, the number of claims purchased must be used within 1 year, and there is no setup fee. For the Premium Plus service, the standard rate is $2.89 per claim with a minimum fee of $99.95 per month. A 1,000 claim annual prepayment option is $2.59 per claim. A 2,500 claim annual prepayment option is $2.19 per claim. Again, with the annual prepayment option, the number of claims purchased must be used within 1 year, and there is no setup fee. Are you using a billing service charging a percentage? If so, you are probably overpaying. Most billing services charge between 5 to 10% of the amount paid, with the average being 7%. So, if you are paying 7% and your average reimbursement is $80 per visit, you are paying $5.60 per claim. Compare that to our highest fee of $3.99 per claim for our Platinum service standard rate. If your average reimbursement per visit is more than $80, your savings by using us is even greater. For example, if your average reimbursement is $120 per visit, you would pay $8.40 per visit to a billing service charging a percentage. Now, some providers don't sign their notes every day. Some sign them every 2 weeks, some sign once a month. If that's the case, you might be able to save. For example, let's say on April 15th, we submit visits for John Smith for April 1st and April 8th with the same diagnosis codes for each visit. Let's assume you're reimbursed $80 per visit for a total of $160. If you paid 7%, you would be paying $11.20 for those 2 visits, whereas if you're enrolled for our Platinum service, you would be paying a maximum of $3.99 for that claim. Now, a billing service charging a percentage will argue they fight hard to get your claims paid, but in reality, follow-up is needed on only 2 to 3% of behavioral health claims. If you submit 100 claims during the month, you would be overpaying on the 97 to 98 claims that are processed without any need for follow-up. And if you visit mbpros.com/save, we have an interactive form where you can calculate how much you can save by switching to us. We do have an introductory special offer. If you register for our Premium Plus or Platinum service, and we are going to be billing inside of TherapyNotes, you will receive 2 months free with our standard per claim rate with a limit of 100 free claims per month. Then just pay our standard per claim rate after that and save compared to a billing service charging a percentage. Pay only $2.89 per claim or $3.99 per claim after the 2 months free. Again, it's a limit of 100 free claims during those first 2 months. The minimum monthly fee applies beginning in the 3rd month. If you want to save, you can purchase a prepayment option. If you purchase a prepayment option, again, you'll receive 2 months free, but you'll save up to 20% off our prepayment options. If you purchase a 1,000 claim Premium Plus service prepayment option, you'll pay only $2.33 per claim for your initial annual prepayment option purchase. If you purchase 2,500 claims, you will pay only $1.75 per claim, which is a savings of 20%. For the Platinum service, again, you save 10% off a 1,000 claim prepayment purchase. You'll pay only $3.29 per claim for your initial prepayment purchase. If you purchase 2,000 claims, you will save 20% and you'll pay only $2.68 per claim for our full service Platinum service. The 1-year time period for using the number of claims purchased begins after the 2 months free. And again, there is no setup fee. This offer does expire December 31st, 2025. That does conclude this webinar. For more information, you can visit mbpros.com/TN2025. If you have questions, you can email us at info@mbpros.com or call us at 877-762-7767. Again, you can see how much you can save by going to mbpros.com/save. And finally, if you want to meet virtually, pressure-free, one-on-one, just go to mbpros.com/virtual. Thank you for attending this on-demand webinar.